and get started, get our recordings in place. It's so exciting to be here and get started. So good evening, everyone. Welcome to Medical Mondays with Dr. O. We're here for another great session to learn how we can prevent disease entities and get ourselves in tip-top form to perform and to do things that are needful in life. Without good health, we cannot thrive. So I'm Dr. Tony Okwesomi, a family practitioner, HIV specialist, and I treat addictions in Maryland. I enjoy these sessions because I learn as much as I give. So welcome. And I welcome one of our sisters, Dr. Stella Nemuseso, who is our speaker for tonight. She's a wealth of knowledge. She's an amazing educator, amazing impactor, and it's just a blessing to have her on tonight. I want to thank Dr. Izugu for connecting us. I feel like I found a sister that I should have found years ago. So thank you, Dr. Izugu. Dr. Stella, I'm going to yield to you and have you introduce yourself more adequately, because I don't think I can do a good job doing it. So the floor is yours, and welcome everyone.
Thank you so much, Dr. O. My name is Dr. Stella Nemuseso. I'm a doctor of physical therapy and I'm a lifestyle medicine practitioner. I'm located in the state of Florida, originally from Zimbabwe, Africa. I'm a master trainer select. I am also a lead trainer for training persons who can work with diabetes self-management, diabetes prevention, and I'm a curriculum developer. It's my delight to be among the finest this evening. And perhaps this is the time we can share a little more. Today, I'll share some information which might have some medical connections, nutritional, relevance, as well as personal experience. Born in the country of Zimbabwe, I grew up in a family where there were like different values and different systems. Some of you know this. But what I want to highlight here is that I was an unwanted child at the age of 7. My father held me upside down, wanted to throw me in the river because he didn't want me. Of course, like any little girl, you'd be so scared to lose your life, right? So I was so scared, I closed my eyes. But when I opened my eyes, something within me shifted. I realized that I'm a fighter, I can survive. However, over the years, I began to have a little pity parties here and there because, trauma always revisits you when something else happens, right? Bad marriage, struggle with this, struggle with that. And I found myself at the age of 38 weighing over 330 pounds. At that moment, the physician who I was seeing then said, if you don't do anything about your weight at this moment, you will be needing a knee replacement by the age of 50. Well, my friends, I'm excited because I'm 55 now and I have not lost any of my joints yet to surgery, and I'm disease-free because I adopted a healthy lifestyle through proactive wellness. So most of you here sitting here are very familiar of what happens to the body, right? With time, with trauma, with exposure to toxins from the environment, from the air, from the water, from our own homes, because over time, the paints deteriorate. The formaldehyde underneath our carpets actually break down and we breathe it. So the body is under attack constantly. So as I was traveling through my journey, then I recognized that no matter how many efforts I make to try and walk, to try and move around a little more, soreness does sit in for those of us who've tried, right? And sometimes it's easy to give up. I also recognized that by the time I was like 45, things started changing a little bit. The amount of movement I could do before, I couldn't do anymore. And I continued. However, over the years, I've also interacted with peers who are in the medical arena, who are in the professional circles, who also experience the same thing. So this brought me to a place where I recognized that I have to do something and my body needs help. And aging was knocking at my door. And I like what I always hear Dr. Izugu say, organ failure from use of drugs. How many of us have heard this term? He says it over and over, like, we got to protect the organs, we got to protect the organs. So this made me realize that when the body is not well nourished, it breaks down. That's a fact. By the age of 45, we start losing cells and we don't regenerate as much as we normally would do. So proactive wellness is about embracing the fact that we are deteriorating from the inside out for one reason or the other, and ensuring that the body receives the nutrients it needs. So even though I was health conscious over the years, the year was 2023, last year, I found myself, I was at the Florida Strokes Registry in Jacksonville, and there was this nice, beautiful hotel right at the ocean. I found myself having a hard time to go up those rails. Anybody has ever found themselves having to hold on to the rail to take the next step? That was me last year. And when I got home, I said, wait, is this the COVID weight or what? Because it was the COVID weight. Since COVID came, we all packed up a little extra than we had before. That includes me, right? So I tried to do some squats and my body was really achy and sore. And then I came across someone who you'll all meet one day, who's a year younger than my mother. My mother is 77 and she's 76. And I saw her, I said, wait, how are you working so well and doing all you do? And then she told me more about proactive wellness. So my friends, I had to lean in and learn. I kind of had to forget everything I've learned before to try and understand this pathway of proactive wellness from a different perspective. And mind you, I've been a lifestyle medicine, practitioner for years, and I've trained community health workers, I've trained lifestyle coaches. But what I didn't recognize is that we all undergo nutritional deficiencies. So our internal organs function deteriorate or fail to meet the demands of life because of deficiencies. And absorption is the key. Most people say you are what you eat, but we say you are what you don't what? Absorb. Makes sense, right? So last year, I came across a concept which I have embraced for myself and my practice as well, which looks at the ABCs, addressing aging through making sure the body receives enough collagen inside it to help it regenerate. So 10 days out of a month, once a day, I take my collagen, brightens my day, improves my elasticity within my body so I can maintain a good blood pressure. Again, the antioxidants. And most of us sitting here are very scientific and very educated. We are aware of the process known as autophagy, or autophagy, if we want to say the British way, autophagy, right? This is where the body uses debris within the body to produce energy. Normally, this kicks off after 20 hours of non-nutritional intake. Fasting, in other words. That's why fasting worked back in the day. Some people fast on a regular basis. What this does, it cleans out the debris, the dead fragments of RNA, dead cells, so the body can detoxify. So I found out that there's a process which the body can enhance this through nutritional intake. So that purification helps to eliminate the damage which is caused by antioxidant process, as well as byproducts of metabolism, which just pile up in our system. And then the B is the blood pressure. Most of my colleagues who are over 40 have all high blood pressure, despite the fact that they work so hard to maintain it, they work so hard to eat well, because life is a stress. We are all exposed to this trauma from the time of birth to the point of death, no doubt about it. But high blood pressure, and I don't want to say it wrongly here, we have the famous cardiologist among us, Dr. Easy in the house. So high blood pressure is mainly caused by peripheral resistance from the interstitial space. Fact, because when the human body is inflamed, there's extra fluid which builds up outside the circulation in the cells. So most of you are thinking, so are we talking about nourishing the cell itself? Yes. So when most people are eating unhealthy or they're stressed, their bodies stay in this state of inflammation, constant chronic inflammation, which results in breakdown, of course. So without maintaining a good homeostasis, a state of balance, the body suffers. So of course, there's a genetic factor to high blood pressure. And we know when people have extra weight that this even gets worse. And we know when there's extra salt intake, it's a fact because there's extra fluid in the circulatory system, which increases the blood pressure. And, so in most cases, chronic inflammation is a fact when it comes to non-communicable diseases, which are preventable disease, which we know, blood pressure, diabetes, heart disease, high cholesterol, and cancer. Cancer is a chronic disease. So in line with that, most of us here are aware of most of the labs we run on our patients. It blows my mind when someone has increased calcium in the urine that they are told, don't take calcium. One thing I learned as a little girl growing up was my mother always lost a tooth when she was pregnant. She gave birth 9 times to 9 children. So 9 teeth were gone because of nutritional deficiencies, of course. When a woman is pregnant, the demand for calcium is higher, right? Dr. O will agree with me. So if that person is not taking enough prenatal supplementation, the body depletes its own calcium to ensure that the embryo or the baby grows in utero, right? And so why I share this is because most chronic conditions we see have a direct correlation to calcium deficiencies because calcium is released at every neuromuscular junction, at every synaptic junction. There's calcium excitation from the vesicles to allow the transmission of signals to the muscle or to the nerve. So embracing this also allowed me to recognize that without taking enough calcium, my body will break down. And of course, the labs can indicate this, that there's a deficiency of this and that, but if the body is not absorbing it, it ends up in the urine. Makes sense with some of the things we see. And I could go on and on and on and on, but I want to land here so I can answer some of your questions. In my practice, I have seen people who come to me because of pain issues. These pain issues can range from joint pain, lower back pain, just muscular pain, stomach pains, and so forth. And I've come to discover that most people have GERD, acid reflux. And when I ask people when they normally experience this, most of them would tell me after a meal or before I go to sleep. It makes sense because when you lie down, the diaphragm, the stomach pushes up and things go up north, and we eat big dinners for most of us on average. And also that after people eat, they mix up a lot of things. Why I share this with you today is because when the digestive system is impaired, there's malabsorption syndrome. People don't absorb. And most of the time when a person is taking an antacid, it really affects the digestion of protein because pepsin and hydrochloric acid in the stomach is meant to break down what? Protein. Starch happens mainly in the mouth with the enzymes and also continues throughout the system with some of the enzymes coming from the pancreas and the other organs as well. So why do I share this? There's a lot of talk now about microbiome, which is the good flora in the digestive system. So every single person who's been taking antibiotics, they have an impaired gut health. So by resetting the gut health, we can improve the digestive system and ensure that the absorption is efficient of nutrients and also prevent leaky gut. And when people used to say leaky gut, I used to say, what? Does that mean a person is going to the bathroom all the time and running and running and running? Oh, that's IBS, irritable bowel syndrome. But leaky gut is a condition where there's damage in the lining of the GI system. So toxins are absorbed into the bloodstream from the GI system. And some of these toxins do cross the blood-brain barrier, which of course we all know about the blood-brain barrier, which protects the brain. So when toxins enter the blood-brain barrier, there's a lot of influence on the system itself because of the higher centers, which control most of our metabolic processes, right? Because when you look at the endocrine system, you have the hypothalamus, the pituitary gland, the thyroid, and so forth. That hierarchy pretty much operates on the negative and positive mechanism. So what I've come to appreciate is this. When a person shows up, there has to be a system assessment, which points to the symptoms they have, which they're experiencing every day, which normally they don't show up at the doctor with until something big happens, especially in minority populations and brown people. So that being said, then, there's a way to reset the digestive system. Unless someone is eating mainly raw, most people have deficiencies in enzymes which are needed for digestion. And unless somebody has never taken any antibiotic at all, their flora in their gut is impaired. So I'll end here, Dr. O, by saying there is a way of embracing proactive wellness for individuals as well as for our clients by narrowing it down to where the deficiencies are, which we see in a lot of organ failure eventually. When people don't eat well, their mood is affected. And this is a fact, especially when it comes to conditions like diabetes, which we all know now is on the increase because we have insulin resistance and we have insulin deficiency in some of our clients. Again, it can all point to organ failure, organ damage, and malnutrition. I will end here by saying, growing up, my mother taught me very well. There's one thing I learned from my mother very well is eat everything on your plate. People in Cuba are starving. And I spent most of my younger years making sure I don't waste food. I would eat everything on my plate. And as far as my memory can I remember, there are many times I had belly ache and I ignored it. And I would just finish that food. And as I travel the world, I've also learned that some people were told the same thing, eat everything on your plate because people in Africa are starving. And I had to tell some people, food doesn't come to Africa through your stomach. So why I shared this is that embracing proactive wellness has a lot to do with unlearning and relearning. So those lifelong learning skills for our own health and for the health of others. Dr. O, thank you so much for this moment.
Thank you so very much. I appreciate you. So for anyone who has questions, our Medical Mondays family know that. Raise your hand or put your questions in the chat box. But I wanted to ask, to surmise, you talked to us about if somebody has been on antibiotics, they have impaired their internal biomes, I'll call it. So solution, I think I took notes. You talked about collagens at first, but I didn't quite get what you were talking about the collagens helping with high blood pressure, and then antioxidants, and what solution is, I guess, what I missed in the conversation.
So the solution is to do an assessment which points to systems, right? When somebody presents with a skin issue, which points to spots on their skin and maybe early wrinkles, most people show up with wrinkles anyhow at the age of 30 these days. It points out to the systems which affected. The skin, even though it shows some of these blemishes or these problems, inside us is collagen in every system. especially the cardiovascular system. So the elasticity and the flexibility of the muscles and the joints is dependent on the nourishment. And I know that there's a lot of people who are pushing a lot of collagen out there. If you really look at it, it's mainly from the skin perspective. And most of us, we tend to do a lot of makeup to cover up our skin when we reach a certain age because it feels good, right? And I don't have makeup. I never owned one. And I'm glad to just wear my skin naturally the way it is because I tend to eat more plant-based. So solution is this, to evaluate the nutritional intake of that particular person or your own. So we've come up with a system. We have a couple of one form, which helps to indicate where the symptoms are, which points to a system. If somebody has low energy, we know why they have low energy, right? Because they are not absorbing what the body needs to produce energy. Makes sense, right? Or they have some insulin resistance issue, which they are failing to metabolize glucose very well within their body, or they have some endocrines. So it points up to that. And then a person chooses what their priority is. Where do they think they need the most change? So with the God-given intelligence we have, most people, they can explain how they feel rather than what is wrong. So we kind of guide them through the process. And again, Dr. O, this is probably for the next session, but I hope I answered your question here.
Okay, so they have to be evaluated by their physician or somebody like you who have the knowledge of lifestyle medicine, because we all know about lifestyle medicine, and on Medical Mondays we have had the privilege to benefit from some lifestyle medicine specialists who have taught us how to change our diet and lifestyles to actually cure things like high blood pressure and diabetes or kidney problems, to actually cure. So that being said, the evaluation, would it be from you or from primary care physicians? Because it's a little bit different type of medicine.
Thank you for that question. So it can be done by anyone. People get assisted. It's not really a medical issue at this point. It's something I'll be happy to share with those who have an interest. But the problem is, and I did share my website where we distribute some of the products which point to these systems. The problems are, Dr. O, we are no longer getting the nutrients we need from food. Food is grown faster. So, and chickens are grown quickly. They feed from tubes now. They don't mate with the male partner. A lot of animals are like that. It's artificial insemination. And the other also problem is supplements are not regulated by the FDA. So the market is flooded. And most people, what they take come out right through their urine. There is no absorption. And also, some of the food, if we are to consume it raw all the time, we absorb the pesticides and other chemicals without cooking. So it's really not a friendly place for some people to eat raw, and absorption itself. What I didn't mention before is that we are all aware of the PDR. It used to be called the physician desk reference a long time ago. Now it's the prescriber digital reference. In that reference book, there's very few products which are there based on science and research. What I'm talking about is in the PDR, which can be found in there, the 6 pillars, which addresses the systems, which I kind of went over briefly because of time. We know that there's a lot of research, especially in North America. And so there have been researches which have done in terms of absorption. The absorption matters. Also, we know of epigenetics. Over time, we change, right? And in order for anything to work, the cover has to be lifted up to penetrate. So harnessing the science of liposomal delivery, which is mainly used for chemo, that's why chemo works, because chemotherapy enters the cell. There is a way to make sure that whatever the person is taking is absorbed. And of course, when it comes to some of what we see today, people don't eat differently. And Dr. O, before I stop talking, I want to say this. If you and I eat 2 boiled eggs tonight for dinner, there's no way your body and my body will handle those 2 eggs the same way. because I might sit on the couch and you might be talking on your phone, walking around. Or I might later on go to the kitchen and grab a cup of milk if I use dairy, right? So when it comes to nutrition, nobody has figured this out. So each person has to figure themselves out. That's the reality. They need to know what bothers them, what doesn't, and certain people should not mix certain foods. So we've been able to help some people gain energy who've had problems with hyperthyroidism or hypothyroidism because of toxins. As you know, you're not supposed to eat coniferous vegetables if you have thyroid problems, cauliflower, broccoli, and Brussels sprouts, because these foods are not good for that. So some of it has to do with avoidance of certain foods, eating a certain way. So it's a conversation. It's a customized process, which over time, many practitioners can embrace. I hope I answered your questions.
Thank you. So you're saying somebody with thyroid problem should not eat Brussels sprouts and cauliflower, something like that.
And broccoli, yes.
And broccoli.
Yes.
Interesting. Okay. So you also told us that you weighed over 300 pounds.
Yes.
Your late 30s. Did I hear that right?
Yes.
What did you do to lose it? Because you look amazing. You don't use any makeup. You said it. And you look beautiful. What did you do to lose the weight?
Okay, so the first thing I understood is the metabolism of carbohydrates. Carbohydrate metabolism is simple, but it's complex, right? And I adopted a process of learning. I had to unlearn everything I knew and started learning about what I need to know. So let's talk about the first thing. Learning how to eat, what to eat, and when to eat was one of the lessons I had to do. And at the center of this is understanding heart health. Dr. Izugu can tell you that, heart disease is the #1 killer people in the world. It's a fact, right? And so when I understood this, I also had to deal with my own trauma of eating to just deal with stress. We work all day and you get home and you're very good friends with food, no doubt about it, right? That's your best friend. So that's what I had to do. And then physical activity. So there is a formula when it comes to physical activity. 3,500 calories equal a pound. If we give you an extra 7,000 calories every single week, Dr. Izzy, you gain 2 pounds. If you're above your basic metabolic rate. So there is a basic metabolic rate based on the age and the sex and all that. That's what I had to understand. So if one needs to lose weight or wants to lose weight or belly fat, which is a big deal in America, most people look pregnant when they are not. The key is to hit the negative. You can do it 2 ways. You can either cut 500 calories of what you're eating now by cutting out the soda pop every day. That's 3,500 calories a week. 7 by 5 is 3,500, right? Or you can move a little more by burning 500 calories a day, 7 days a week. That's 3,500 calories. So the program we offer for diabetes prevention, which is part of the National Diabetes Prevention Program, gives people an option. They can cut down by 500 or 220 or 250 and move 250 calories burned a day. So it's a formula. It's also a formula, and it's also a change of thinking, unlearning that I don't put sugar and I don't put too much food on my plate and then end up eating it because I don't want to throw it away because somebody else doesn't have food, right? And so it's a lot of factors. But at the end of the day, I'm going to say this. I actually wrote this concept, so I shouldn't probably talk about it. But life's decisions are based on knowledge, emotions, skills, and support. Seriously, making a decision on what to eat is a skill, whether we like it or not. And there's a difference between knowledge and information. The 21st century, we are loaded with information. It's not a problem of information. It's a problem of understanding data, information, synthesizing it, and then making it useful to us. So that's part of what I did, and that's part of what I do. And I train a lot of people to help embrace this for their own practices, as well as those who just help people in the community to help understand this and navigate this life challenge of health and wellness.
So we also have discussed, you and I, about, this lifestyle medicine, and the experience we have is that the lifestyle medicine specialists teach plant-based diet. But you made a comment that some people don't want to let go of their meats, and it's okay. And with that, you still effect excellent health and weight loss where it's necessary. Can you comment on that, please?
Yes.
Or walk us through that process.
Yes, so there are several schools of thought when it comes to nutrition, right? There are some people who believe you got to count calories. I don't do that, though we have a resource which does that on our electronic health record, where people can just enter their food and say, I want to consume X amount. It's very laborious. It's not sustainable. We know that. However, there is a resource which was created by the government. I believe it falls under the USDA. It's called My Plate. So myplate.gov gives these people a guide, which is a plate based on a 9-inch size plate. If you visually divide it in half, and we have the divided plates here. I should have brought one to just show you that we have one. If you visually look at a 9-inch plate, half of that plate should be vegetables, raw or cooked. The other half, you divide it into 2 quarters. A quarter protein, a quarter starch. So that's what actually we encourage people to do. What's very interesting is I have only met 2 people in the past 7 years who know about My Plate. Most people don't. On myplate.gov, there's even a formula you can put in your age. It can tell you how much protein you want to eat. We love too much protein, too much meat. We only need about 49 grams. We love too much starch. We only need about 45 grams per meal. That's about 2 slices of bread on average. So what we find also, which I found myself, is that there are traditions which we have adopted, especially in our developed world, which says this. On a plate of spaghetti, Dr. O, you have spaghetti, which is starch. You have spaghetti sauce, which is sugar and starch, and then you have garlic bread on the side, right? And then a sweet potato pie or apple pie later. So why I say this, because one thing people ought to know is the food classes. So anything ranging from how to shop, how to cook, how to make decisions, how to eat out, how to also cope with challenges has a lot to do with that. So we do offer a training, which is 2-3 days for people to learn how to change behavior. So before I stop talking, I want to say this. I could talk all day. Behavioral change is part of this, right? There's many theories of behavior change. The one I embrace is the trans-theoretical model of change, which talks about stages. There's a lot of other ones there. I like them, but they're too complex for an average person to understand. So behavior change with 5 stages, sometimes people say 6, is this. There's a pre-contemplative phase where somebody hears something and say, it's not for me. Just like me at the age of 38, when my doctor was saying, you need to lose that weight. I'm like, my grandmother has always had a big body. Big bodies runs in our families. And I've come across some people who will say, I don't want to lose my virtues. I've been told that by some of the faith-based leaders, women, they're like, I don't want to lose my virtues. We, African women, we're big. So anyhow, so pre-contemplative is when somebody's like, there's too many cons than pros. But if that person keep hearing the message, they come to your place like, I'm going to show up at Dr. O's medical mandates. I think she is something for me. That's contemplative. So a person shows up here and they learn. But in order for change to take place, the person has to move to the main action phase, preparation. And preparation looks like this, Dr. O. Like for me, I'm going to put my sneakers next to my bed. When I get up from my prayers, I'm going to put them on and go to the park. for 30 minutes before I take a shower in the morning, preparation. And then the next one is action phase. So it takes 6 months in the action phase for behavior to stick. And it takes another 6 months in the maintenance phase for behavior to become permanent. So what this means is like this. If I come visit you in Maryland and you're like, here we go to the Chinese restaurant every night, let's go. It's kind of hard for me to say, Doctor, I don't really want to go out because I feel like I don't want to, you're my friend, I'm going to be nice, right? And do it. But when I come back home, I might be just going to a Chinese every night, right? So the environment not only talks about access, it talks about influence and how we do like those around us. So those are some of the things which I had to watch because I noticed something, and I do this with my clients, by the way. Right at the door, as you walk in, there's a scale. So we are paperless, but I maintain a log on every single one of my clients. And when they come in, I said, here, we check weights here. There's a scale over there. That scale will be your friend. And it's interesting how people change their behaviors by just looking at their weight 3, 4 more times. They're like, I got to lose this weight. So it gives me an opportunity for coaching because I'm a master trainer and I'm a coach. I'm like, so how do you think you're going to do this? They either say, I don't know, you tell me, or, I think I need to eat more vegetables. So motivational interviewing is a skill which practitioners need to have to listen to that opportunity for a thought process for change. And that's one thing I had to do to me as well. I had to monitor how I think with my relationship to food, stress, and physical activity. It's a long laundry list, but we'll do this. All right, Dr. O.
Wow. Fantastic. I have a question, but geez, Dr. Okweyemi Adewale has a question. So I'm going to defer to him. I'm going to let him ask his question first. All the way from London.
Yeah, thank you very
Welcome. Good
much.
morning.
Good
Over
morning.
there.
Good morning. Yeah, thank you very much. That's another very exciting lecture. I've been saying maybe you tag this session Dr. O University. Anyway, on a lighter mood, I'm interested in the more elaboration on issue of the antioxidants, because I've noticed that the trend is changing now with respect to how we manage chronic diseases. In those days we say, okay, even some people still practice it. Don't take this, don't take this, don't take this, don't take that, and we keep, going against those kind of mountains. But when we understand the concept of the antioxidants that are actually can be attacking, what's it called, negating the effect of some of the inflammation stage, how do we balance it now? Because how do we know how much of your antioxidant intake that you actually need to suppress the level of the pro-inflammation stage? I agree to the fact that most of the diseases are chronic. Some diseases don't show up in the body for 15, 20 years. Even some studies find out that it's up to 30 years before a certain chronic disease showed up. So it means we have all the long time for us to actually manage our disease, our states. So having said that, I would like you to make more explanation on that. The second thing that I want to mention, we have to do with the emotion. To emotion, like you all know, is very, very a crucial part of our well-being. And is how do you want to make our emotion? How do we manage the emotion with respect to food? You mentioned something right away about motivational interviewing. Yes, I agree with motivational interview. But I've noticed that most of the psychologists, they use the negative, negative motivation rather than, what do I mean by negative motivation? I tell you that if you smoke, you're going to have lung cancer. So I show you a picture of a lung cancer, how it has destroyed, how it destroyed the body. So the person will be afraid. I don't want to have lung cancer. I don't want to be fat. So I will rather stop smoking. It's not working. It's not. It works. It's worked, but we can't guarantee 100% of it. So how do you use emotion, right motivation to enhance well-being? Thank you.
Dr. O, you want me to answer that?
Absolutely. The questions are for you. They're not for me.
Oh, you're number one. So I'm going to start from the bottom. Emotions, I can relate to that. So there are different reasons why we feel a certain way, right? And in order to address emotions, we have to get to the root cause of it. I mentioned earlier on that as a child, I was dangled on top of a flowing river and I was getting ready to be dumped, right? At some point in my life, that was my emotional crutch, very much for my emotional crutch, where I just felt like, I lost out something when my dad didn't love me. And so food also was my comfort, and retail therapy was also my comfort. So when it comes to emotions, I don't believe in like scaring people. No, there is a process. And I'll share with you my good doc there, and I'll be happy to share resources with you as well. So there's two things which can influence change talk. So we call it change talk, right? Change talk is when someone shows you that they might be ready to change, right? So I tell everyone who I deal with that by showing up, you've succeeded. And by even wanting to have this conversation, so I want you all to give yourself a hand by being here. You're change agents, right? You showed up and you said, we're going to go to Dr. O's Medical Mondays. So change is key. However, for someone I don't know, I've never met, there's a tool which works very well. It's called a wellness vision, right? So Dr. O, if Dr. O comes to me and I've never met her and she just don't feel well, and I don't know where to start, right? Most of our patients are unwell. A wellness vision helps a person to see where they want to be. So it can look like this. Dr. O, where do you see yourself 30 days from now, 6 months from now, a year from now, and 5 years from now? I don't always use all those, but depending on when a person is talking, they tell you what they're passionate about. So for most of us who are here, where do we see ourselves a month from now? So for a person who have high blood pressure, they might say, I want my high blood pressure to be under control. I don't like these drugs. And that's how they all talk, by the way. Sorry, doctors. My doctor gave me another drug. I'm not taking it. I'm just doing garlic at home, right? And that person is not changing their lifestyle. We know they're going to get a stroke, right? So if a person begins to see themselves where they want to be, they are now willing to take the necessary steps to go there. So the key is for every single provider out there and every single person hearing my voice, we need coaching skills. Coaching skills use more of a motivation than a scare. To be honest with you, most of our patients do not care if they get diabetes or not. And look at our numbers here in the US. We have about 96 million people with diabetes. So we are sitting at with diabetes, 34 million and 96 with pre-diabetes, something like that. We're like 120 million people who are on the verge of getting diabetes in the next 10 years. They are predicting that 1 in every 3 by 2030 or 2050 will have diabetes in this country. People are not even scared of that. But when you say to a person, where do you see yourself in the next 5 years? Oh, I want to be traveling. Who do you see yourself with? I want to be with my grandchildren. So motivation is when I start connecting the dots. about what's meaningful to me is me, not what my doctor wants. Those patients tell me, I don't know why my doctor give me that. I wish I would change doctors anyhow, because they think you are making them take medications because you want to. So perhaps to ask this person, what can you do to keep this blood pressure down? Or to, what are some of the things do you know which you can do? And let the person tell you, this is what I know. What stands in the way between what you know and what you're doing? So this whole idea is to help a person walk through it in their own mind to find a solution. So coaching is when we walk side by side, and that helps to harness the right information. I can tell you, I am not an expert, but I can help anybody change their thinking, because I listen to them. Once they show up, I ask a person, what is it that you want me to help you with today? When you live here, what is it that you need from me? And this is what I hear. I want to have less pain. I want to know how I can prevent my condition from getting worse. And most people will tell you that. They will never tell you that I need a pill. They used to back in the day, because they wanted free stuff. They'll say, and they will not also hide it when you ask them a direct question like that. So perhaps harnessing the emotion, begin by acknowledging that someone is making an effort and they are here. And now that we are here, what is it that we're going to work on? So collaborative goal setting is the next step. When a person say, I want to be here in 10 years, I want to be in Cancun, Mexico in 10 years, able to walk when I go on a cruise, they will tell you stuff like that. And so you hold on to that and you build onto that. So it's almost a relationship, which now with a shortage we have of practitioners in the US, in my area, if you need a new doctor, you just moved in, it's not until September you can get one. So now it's taking spaces for people who are acutely ill, because some people are chronically ill. So this wellness model is going to take us as well having to even classify some of those delicate patients who, not by their own fault, they're suffering, but they need the care. But everybody's on a chronic care model. Every 3 months they go to their doctor. And you can't stop that until a person takes responsibility. And that's why we are working on training community health workers throughout the world with Dr. O and Dr. Izugu. So I want to move on to talk about oxidation, antioxidants. It's a word which has been so commercialized that you can even get a bottle of water which tells you that it is antioxidants, right? You've seen it. But to be honest with you, there are two things: minimizing toxins and embracing nutrients. So some of the naturally occurring products which can help, which sometimes doesn't come with food, it's a long list, but I'm going to go through it very fast, include turmeric. But turmeric, which is CoQ10, curcumin, is not absorbed by the body. The molecule is too big. So if people are just putting turmeric in their curries, in their rice, the body can't take it because it's too big. So either you have to add black pepper if you're on the natural side of things, or you have to take it in the form where it has been researched that the absorption rate is higher. So in what I would share with you in the future includes turmeric. And that's very good for recovery of soreness. It's very good as an antioxidant as well. Collagen, ginger, shiitake mushroom, acai berry, resveratrol, boswellia, black cumin, black seed oil, you all know it, zinc, selenium. Selenium and vanadium are not found in food, so people have to supplement, and chromium. So most people with diabetes have a deficiency of selenium, chromium, and vanadium. Biotin, pomegranate, glutathione, CoQ10 for the heart and cardiovascular system, probiotics for the GI and the immune system. So GI system and the immune system are cousins. When digestion is impaired, immunity is impaired, because we know that immunity is produced in the cells in the GI system from physiology and anatomy, right? Then you have prebiotics, organic greens, and organic fruit, milk thistle, and elderberry. So that's among some of the things people need to supplement with. So on one hand, you see the supplementation, the nutrients the body needs. On the other side, you see the toxins, which potentiates, which means it increases inflammation. Inflammation, from just the simple definition, is the body's response to anything, right? Which can be a chemical, which can be a pathogen, which can be trauma. And we know how the body responds, these 5 cardinal signs of inflammation, right? Redness, swelling, pain, loss of function, edema, we know those. So in as much as we understand this when it comes to the periphery, like the arm, the leg, it's also internal. That's the good news. And the sad news is when we have an intake of artificial sweeteners, artificial preservatives, which in most cases, anything which is powder has what they call an adjuvant. An adjuvant is something which has nothing to do with food, which is added to a product so that the granules stay in the right form, so they don't, lump up. So salt, for instance, table salt is an adjuvant. That's why it doesn't clump up. So if somebody is using regular sea salt, which is aluminum and adjuvants, to keep it like that versus the salt you grind yourself from its hard form, then there is an adjuvant. So if you look at every level, you will see there are additives which are just adjuvants, which maintain the state of that processed food. So powders, granules, you name it, have a lot of this. And then you're talking about synthetic isolates. So part of the challenge we're facing, we are suffering from microplastic. People use paper plates. I don't get it. Just use your own plate and wash it. It's physical activity. Use your own spoon and just wash it. You save money. You save the world. So things like some of these things like, styrofoam cups and plates and paper plates, it's just something which I don't get it. I carry my own plate. I eat in glass if I can help it. All these plastic containers, microplastic is a toxin. So you put a plastic into a microwave, you even make it more toxic. It was toxic anyhow from reacting with your food, things like that. You've all seen it. You put a plastic container food, it stains, it breaks down from the inside out. So minimizing some of these toxins which come from gluten, a lot of people have gluten sensitivity, which they respond by swelling. And you can check this. Go eat as much gluten as you can, get on the scale the next day, you'll be at least 2 pounds heavier. And it's just inflammation. You're not heavy, you're just retaining fluid. So corn is a really controversial food. I know we love fufu, we love chima, we love everything else made of corn out there, but they have treated the corn seed so the pesticides don't eat it. Because if the pesticides eat it, we don't have enough. So things like that. So sometimes these allergens are in peanuts, in dairy, in eggs, in oats, in whatever people eat. So I'm not saying we can avoid this long list, but you're also talking heavy metals, which could be present in some of the things we eat with toothpaste. Most toothpaste is heavy metals, depending on which one you buy, and pesticides and mold and stuff like that. So the list is long. There is no way in the world we can 100% avoid this list. But if you take this list now, and then you have fried chicken every day, then now you're talking insulin resistance. No doubt about it. Type 2 diabetes is knocking as fast as it can. At 45 and 65, it shows up. So there's a lot of other things too, like, radionucleotides. There is electromagnetic issues coming with the microwave use. There's a lot of stuff. So what I always tell people is this: things which are convenient can be harmful. Identify those things you can minimize. I don't get it why somebody should buy cut onions from Publix. I'm not going to be negative about it. Why not cut your own onion when you're ready to cook it? It takes less than 2 minutes. It's exercise. You're using your own hands, right? So things like that, sometimes that's all people have to change to say, I'm not going to buy cut carrots. I'll cut my own carrots. Put it whole if you don't have time to cut it, or just break it in two and still cook it. It still goes, right? So I want to say then, some of these things, we therefore find them in some of the supplements people take. There's about 90 plus supplements. If you find the whole list and you list them, they're like 90 plus, like 93, I think. So sometimes people are trying to consume all those 93 things, and Everybody has these bottles sitting in their closets for years. And when they don't feel good, they just grab. Some of them are even expired. So I don't want to go too far further than this, but think about the organ. And I want to also tie in with the emotions. Think about internal organs and what innervates the internal organs. And everybody should say the autonomic nervous system, right? We got the parasympathetic nervous system and the sympathetic nervous system, which responds to neurotransmitters, right? People have heard about adrenaline, norepinephrine, acetylcholine, and all that. This is what I tell my clients. The body doesn't know much, except that the body operates with a system of doors and keys. That's what I tell my patients. They're like, what you talking about? I'm like, your sympathetic nervous system can respond to stress just the same way it could respond to a poison you just eaten. Of course, most of these things we end up with potent vasoconstriction, which now leads to high blood pressure, no doubt about it. Because anytime we excite and activate the sympathetic nervous system, we're ready to fight and run, whether we're upset or not, or with most of what we are talking about here ends up having constantly stimulating our sympathetic nervous system. And all these internal organs are on fire because we are ready to fight. So stress management is part of it. So I just want to say this, perhaps at some point, we brown people have to put our heads together and say, what really is meaningful to me? If you talk to a person like me and you say, measure your food, I'll say, no, I can't do it. I've never done it. You talk to a person like me and say, check your calories. I'll tell you, no, I've never done it. It's too laborious for me. I don't have the time. So perhaps the My Plate method would speak better to most people. It helps a lot of my clients. I have them in my practice. I give them away. I'm like, go use this. They love that because now it's sitting. I give them meds. The My Plate meds, I only have the Spanish left. I'm like, here. This is for you. Put it next to you. On the back of it, they're like, oh, so I'm supposed to eat like that? And so it's a skill. Remembering is a skill. Doing is a skill. Knowing where to get information is a skill. So giving people visuals also help. So let's turn our practices into proactive wellness. Please email me, Dr. O. We're going to get together and start a training. Thank you.
Ooh. Thank you so much. For me, take home there.
Thank you.
Thank you. Yes.
Excellent. Thank you.
Yeah, Dr. Adewale is thanking you, Dr. Stella. So,
oh, most welcome.
Take home there. You're right. For me, I cannot count calories. I'm sorry. I don't even know how to count the thing. Or when you were talking about 24 grams of protein, I actually wrote that down. No, 43 grams of protein, you said, and 45 grams of carbs. I'm like, so what's that? What size is that? So for us, brown people, like you call us, we don't measure. Even when we cook, we don't measure. We trained to just, I don't know. People have asked me for recipes of stuff, and I'll be like, okay, take rice, blend your tomatoes, onions, pepper, and this, and dump it. How much did I do? I'm like, you know what? I don't know. So it's not a thing. So thank you so much for bringing up that plate divider. Half of our plate should be vegetables. That's a huge take home for me. But Dr. Duyebo asked here in the chat box, he said, hi, Dr. Stella. Thanks for the wealth of knowledge you shared tonight. Truly appreciated. The propensity to be predisposed to inadvertently injuring the pancreas, leading in a downward trajectory in the development of full-blown diabetes, has been an age-long fear for Black people, as reflected and confirmed by extensive research studies. What can Black people do to slow down the speed of this damage, especially from age 40 years up? Before you answer that question, I wanted to just say something, that when there's pancreatic damage, when the pancreas has a problem, then the that causes diabetes, that would be diabetes type 1, where the pancreas is not making insulin like it should. What we see a lot that Dr. Stella has presented tonight, the staggering numbers that we see in diabetes, and 1 out of 3 people, maybe it's 2 out of 3, developing diabetes in 2040 or 2045, research is showing, is type 2 diabetes, which actually the pancreas is producing insulin. It's just that the absorption of insulin is what is impaired. So in the periphery, for one reason or the other, obesity is a big one. So if you please answer that question, that what research is showing, which is right, the bottom line is that diabetes is, increasing in Black people. What can Black people do to slow down the speed of this damage, especially from age 40 years up?
Thank you, Doc. So there's a couple of things which I think we all need to come to an understanding, is that our bodies can only put up with so much abuse. And this is what I tell my clients. I'm like, listen, I actually have aprons in my office, believe it or not, with the internal guts. So I took this message and I made it very simple. The stomach is like a blender, right? If you take off the little top of your blender and you turn it on, what happens? And they'll say, oh, it's going to go all over the place. I'm like, right.
Yep.
So if the stomach is blender and things are going up, what happens? Well, you get acid reflux, right? So to answer your question, it's a couple of things people need to know. The stomach is the size of a fist. And anytime the stomach is loaded with food more than the size of the fist, the human fist, the pyloric sphincter, which is a little ring which sits above the stomach, is going to stretch, right? Dr. O, you nod in your head. So when this happens, anytime, since the stomach is like a blender, it's a muscle, it's gonna churn the food. What happens with the food when you churn it and the top is loose? Reflux. So a lot of brown people suffer from GERD. And what is the method of intervention? Is the antacids, right? And the proton pump inhibitors. And now we're impairing the digestion of protein. If you look on the internet, they'll tell you that meat will sit in the gut for 3 full days. And I've heard some of my patients say, I read this for myself and I'm not eating beef anymore. Brisket is out. I'm not saying quick brisket, but that's why some of the lifestyle medicine practitioners are actually going plant-based because of that, because that's a true fact. So most brown people need to know that when we put 3 times our fist of food in the belly is going to stretch, correct? It's a muscle. It becomes inefficient. This is the same thing with the heart as well. It becomes inefficient when it's overly stretched. It can't function well. That's his key. However, if a person is eating 3 times of their fist in terms of starch, what does the pancreas do? It produces more insulin, more insulin, more insulin. Do you think it's going to produce more insulin forever? The answer is no. So at some point, the pancreas stops producing insulin. And some adults have been diagnosed with type 1 diabetes, insulin dependent, because they no longer have enough insulin. It's tired. In Spanish, it's el fatigue. It's tired. It's fatigue. So consuming excess starch from a very young age becomes a problem, but the body copes with it until when we reach the age of 40, because we are starting to lose cells than, gain cells. We are not growing at 40. We grow up to puberty or 23 for most people, right? So we are growing backwards. So a person has to adjust how they eat as they age. Perhaps at 40, we need everybody before they turn 40 to say, be prepared to cut down on the starches, right? For some people, the pancreas is working. However, because we eat a lot of fried foods and all that, the body doesn't see it. It's called insulin resistance. So type 2 diabetes comes 2 ways. One is overuse of the human body system by excessive consumption of starch. And I want to say starch, sugar, carbohydrates. Somebody was opening, I think Randall, you're holding a package of your food. Thank you for joining. Randall is on one of our teams here in Florida. When you look at the package of the food, it will say carbohydrates, then it says sugars, then it says total carbohydrates, right? Most of the time. They say total carbohydrates, which includes high corn fructose syrup, which is in there. It includes fiber. Fiber is your friend. We want food with more fiber. And it includes carbohydrates, which is just starch. So if you take shima, Dr. O, which is made of yam, versus, no, it's not, it's fufu, which is made of yam, versus shima, which is made of corn. Those are two different dishes in terms of their starch content, right? So some of what we are seeing now is people substituting what they normally would cook fufu with. Now they are making fufu with cornmeal. The carbohydrates is two different levels. So our brown people, most of our brown people are allergic to salt, flour. A lot of people have allergies to those things. They are, but they eat a lot of bread. Everybody eats bread for breakfast and tea. It's a custom which people have done over the years. So what I can say is that those turning 45 needs to know what happens when you get diabetes. Diabetes is the number one of heart disease, blindness, cataracts, retinopathy, and glaucoma, end-stage renal failure, kidney disease, loss of limbs through amputations, peripheral neuropathy, peripheral vascular disease, heart attacks, and strokes. So with what I've said here, when the high blood pressure shows up, diabetes will show up. It's a matter of time. So this is what people need to know. There's two categories of risk factors. There's risk factors I cannot change, right? And there's risk factors I can change. So on the risk factors we cannot change, being an African-American, a Black woman, I'm a risk. I have higher risk of getting any of the above. Any chronic disease, an African-American woman, a Hispanic person, an African-American man also, don't get them wrong, and Asian Americans. Here in America, we use those terms. But in UK, you might use different terms. But that's why I call brown people, because those are brown people. And anyone who has a mother, a father, a brother who had diabetes has a higher risk. So it's a point system. When you get 5 points, you are already pre-diabetic. So it's used by the CDC here in the US, the National Diabetes Prevention Program. I can share that with you. So everybody needs to take this risk assessment. 5 and above equals almost a A1C of 5.4 to 6.4, which is 1% before you can become diabetic at 6.5. So there's not enough room there once somebody has a risk. So on that side also, any woman with gestational diabetes is a point. So for most of you who are 45 here, you already have 5 points, no doubt about it. So you either have pre-diabetes or diabetes. It's a fact, unless you're taking care of your health. And any woman who gave birth to a child 9 pounds or higher is a risk. And I'm counting the risk factors, which we cannot change. And any person who was born 9 pounds or higher has an extra risk. So the risk factors we cannot change are associated with family history, who we are, and these are the things we cannot change. However, on this side is things we cannot change age. So 45, give yourself 1 point, 65, give yourself 2 points. So age adds more points, period. But on this side, there's 3 things we can change. Just 3, that's it. 1, manage high blood pressure. You take a point off, because when you have high blood pressure, you add a point, right? 2, maintain a body weight with a BMI, which is 25 and below for Asian Americans. And for African Americans, really is below 26. So body weight is another one. And the last thing is physical activity. Anyone who's not moving a minimum of 30 minutes a day, 5 days a week is a risk. And these standards, we've known them for years. So now it's up to a person to say, of the things I can change, what can I do to manage my high blood pressure or reverse it if I can, so it's under control, or be physically active, stretch, move, squat, do what I do these days, right? Or you gotta lose that weight. So there's only 3 things we can all do, and manage stress, of course, because stress is a factor. Everybody has that, but we can manage it. So Dr. O, I just want to say this, and I might be crossing boundaries here, but one thing which makes my clients change their ways is this. I talk to them about how many categories of high blood pressure medicine we have. One, we have those diuretics, right? Like HTCD, furosemide, which we use. Really, all we are doing is we want to get rid of water. But we know when we eat salt, water is going to show up, right? Then we have those peripheral vasodilators like lisinopril and so forth. We know when you're tight and stiff and obese and inflamed, how much can you dilate those vessels? Where are they going to go, right? You're going to do something. You eliminate the weight, the fluid, and you stretch. And the other class are the beta blockers, which is really kind of hard on the lungs because they're bronchoconstrictors. So for some people with breathing problems, it becomes. And then the last category is the rescue drugs, which we use when, clonidine and the rest of the drugs which are used when things are too high, take this, right? So when I talk about medicine, some of my patients start to think, I'm already taking 3. So you think my doctor is going to add another one? I said, no, your doctor is going to increase the dosage you're taking and give you a rescue drug, which you take when it's 220/90, whatever it is. And that's what they say, what? So you mean to say I'm going to get more? I said, yes, you end up with 30. I don't scare them, but it's true because I've seen people with $15,000, $16,000 worth of medicine a year. That's minimum wage in Florida, pretty much, just on medication alone. So why I'm saying this, I took a class on medication therapy management from University of Florida because I was very curious why we research so much about brown people and their behavior. And I said, I want to know how people handle their medicine. I can tell you, it was shocking to me. Medication adherence is a big problem. People don't take the drugs the way they're told they should take them. When the doctor gives somebody a drug and they tell them this is for your blood pressure, that person says it's for my kidneys, but my kidneys are fine. So they don't take the diuretic because it makes them go to the bathroom a lot. They won't take it. And all the days when they have a doctor's appointments or they're out, they don't take it. They say, I'll take it when I get home, but when I take it, I get home, I stay up the whole night. So they don't take it the days they are off. So what ends up happening, some of them, they don't refill their medicine, they keep it. I saw so many people with expired medicine. They came from Puerto Rico during Hurricane Maria, they still have it. They're still taking that expired metformin. So understanding how drugs work is key for every person because they have to adhere for it to work, right? And also they have to know when to take it. I saw one lady who was taking all her pills in the morning, and there were 15 of them. And she was falling. And I said, why are you falling? She said, I'm dizzy. Do you have vertigo? No. What's wrong with you? I get so dizzy. I have to lie down between 9 o'clock and 1 o'clock. And when I have doctor's appointments, I don't take my medicine. And it helped me connect the dots. I said, listen, you're taking all this. And when I took a closer look, she was doubling up on her blood pressure medicine because she saved one of them. She went in the hospital, got a different formulary, and she saved it. So whenever she checked the blood pressure, she would take an extra one of the other one from the hospital because she believed that the hospital gave her better medicine than what the doctor gives because the doctor works for the insurance company. So these are some of the things people think like that. So I'm just saying, for brown people to understand early, anybody, how medicines work. Medicines work when you do your part as well. You take them and you take care of your lifestyle. And I think it would help them to say, okay, so my doctor is not going to help me if I neglect myself. My mom was that victim who did everything bad. My doctor would take care of me. Until one day she went to the doctor and the doctor didn't know that she didn't have neck pain. Then she came home, she said, wait. So if I didn't tell my doctor my neck hurts, he doesn't know. I said, mother, yes, doctors only know based on what you tell them. And she then later on realized, okay, so I need to know my body. I said, yes, because they don't guess your neck hurts. She said, I didn't tell him, but I wanted to see if he knows. And my mother is old school. So doctors are not, magicians. They only know what we tell them. So I keep these little books in my office and I tell my patient, write down the things you want to tell the doctor and what you want to hear from the doctor. Because they come back and they say, my doctor didn't give me a chance. They only give me 5 minutes or 10 minutes or 20 minutes, whatever. So strategies is to how you communicate to your provider so they can help you. And I tell them, if your back hurts and when you twist, the pain goes down your leg, tell the doctor that because he won't know you have pain going down your leg, right? So understanding how to communicate and to respect that our doctors know more than us. Lastly, when brown people are diagnosed with a condition, they call their friend. They call their friend, they call their relative before they call their doctor. They come to me or they ask somebody who will call me and say, ask Dr. Stella. I'm like, why are you asking me? Go to your doctor. Well, I want to know what you think. So community health workers is what we are going to do to use to solve this problem. Dr. O, Dr. Easy and I, Izugu and I, we are going to train community health workers starting in the state of Maryland and every single place so people can learn within their communities. Because the level of diseases or sicknesses has increased, that to triage a patient in 1 hour and 30 minutes or whatever and get an idea of what the priority is in that visit is hard for all of us. So lastly, if a person gets the survey before they go to the doctor and fill it in before, it can help the provider to review it just before the person goes in to better understand where to focus. So comorbidities are a problem as well in young adults. And I'm going to end here. Metabolic problems. We have a lot of young females with polycystic ovarian syndrome showing up at the age of 19 because of everything else I talked about preservatives. And it's very hard to treat a 16-year-old who's a type 2 diabetic because there's not enough research today to support teenagers suffering from type 2 diabetes. And yet type 2 diabetes is now showing up in people who are under 18 and under 21. I'm done.
Thank you so much. Thank
Yes.
you. Oh, wow. Well, we treat them like adults because they have the weight of adults.
Yes.
And so that's what we've been doing, but that's not the way it should be. So take home, treat high blood pressure if you have it, exercise, and lose weight by lifestyle changes. Actually, we have more classes of blood pressure medications. Dr. Izugo would tell you, and he has talked to us about the ARBs, and stuff like that. But that is not that the classes, yes, they are there. And you write about the diuretics, the water pills, that people don't take it when they go out. I see patients, you're right, we will come in, the blood pressure is high. Why didn't you take your medication? Oh, did you take your medication? No, I didn't, because it will make me pee. And so they don't take it. So the doctor cannot tell if they need to adjust the medication, what they need to do, if the medication is controlling the blood pressure. And what we have seen in the US is that it takes 4 to 5 different medications to treat a person for blood pressure a lot of times, because we try not to max the doses so that it will not increase the possibility of the adverse effects that can occur from the medication. And so we add, and we know that each medication does different things also in the body that are positive. So we try to add them to merge them. But all of this will not be necessary if lifestyle changes appropriately are done, appropriate weights are maintained, and then one will need to worry about that. The risk factors that one cannot change, like the genes. But then if it's the genes, it's usually then easier to manage than when it is, lifestyle changes and the changeables that people have not changed or that they have enabled. So thank you so much. This is a wealth of information. Dr. Izugu, kindly unmute. Yeah, you have your hand raised. Thank you.
Sorry,
Yeah, we
guys.
hear you. Thank
Okay.
God you are heading home.
I am heading home.
Thank God.
God.
Long day, as usual.
Yes,
The Lord is your
Stella.
strength.
Yes, Stella. Thank you so much for your presentation and really providing us a lot of information on prevention. Again, underscoring that a lot of these conditions can be prevented if we start on time, and also if we understand that we as patients. A patient, you play a major role in that prevention process, and you have to form a team with your doctor and really do the necessary things. And if we focus on prevention, some of these disease complications where you end up with heart failure, stroke, and all that can actually be averted. And from this discussion now we have here, you can find that if you really focus on prevention, you can do prevention in a small office and teach people. You can do it by Zoom this way and teach people how to really do the right thing for themselves. And also teach them how to best manage that hypertension, and then also teach them how best to eat and what to eat and how to avoid the things that can harm the body. And this is something that many of us really have to really do as much as we can to get the powers that be the importance of focusing on prevention and really working with them in a way that they don't really just focus, get a patient to the hospital, get to the hospital. We can really do a lot of things to prevent them from getting to the time of going to the hospital. You can also realize that conditions such as obesity, high blood pressure, and diabetes are the major cause of all these major problems we run into. Okay? And that we can do something about them by really education. And we're also finding that, you don't have many cardiologists or nephrologists or pulmonologists or even internists in many of the neighborhoods that need this care. So that educating and using community health workers becomes important. So that's why, again, Stella mentioned about that. And we're going to be capitalizing on using that because that's the best way to reach people in those neighborhoods from childhood to really begin to change those things on how we eat, the exercise regimen, and also how to cook the food we eat. Thank you so much again.
Wow. Wow. Thank you so very much for that robust contribution. Thank you. And look, if you notice in the chat box, Dr. Stella, thank you so much for being so generous for posting your number. Dr. Stella has posted her number. So if you need to reach her, to dialogue for evaluation and to see what right course to go through for weight management, decreasing that weight, decreasing the disease entities that you may have right now or eliminating them. A number is in the chat box. Again, I thank you for being generous with your personal number because I know your number. And, I've been posting and reposting the dynamic lifestyle international through international.com link that you will see all those products that I'm going to talk to her privately to know those things that I need for me. And our website is info@dtos.com. It's all in here in the chat box. Dr. Adewale, Opeyemi Adewale also said, thank you, Dr. Stella. He said he has come to realize that airways should also be well managed. Many people are still not intentional about their breathing. Deep breathing exercises should be part of our cheapest option for general wellness. What's your comment on that?
Yes, so yeah, that is so true because we have residual volume in our lungs. So our lungs are like bags, right? At rest, we just breathe on the surface, on the top, which allows air to go out and in. But there's still air which stays at the bottom of our lungs unless somebody is running or jogging and really like overexerting, most people are shallow breathers. So that deep breathing for sure helps. That's why you see the Apple Watches have a reminder to take a deep breath now. They've actually integrated in the wearables now to remind us, because we are all just focused on what we are doing. It's important that the body gets oxygen, water, and nutrients, and a little bit of sugar. And while you were saying, Dr. Easy was talking about prevention, for sure, and this might sound a little uncomfortable, some people, but our patients also watch us and see our own lifestyle efforts. And when we as providers make this effort, they also want to embrace it. And putting in systems which just help people understand that we are trying together. It's a journey we all should work on. It opens up that ability for someone to say, I want to try it too. And so it's a community effort. It's going to take all of us as well. There's one thing I also wanted to mention, that health and wellness, they are very well closely related. I think leading with prevention is what we ought to do. There is a process for train the trainer where we can train people so they can train others. And that's what Dr. Easy and Dr. O and I are working on. And if anyone needs to come and connect with us, Dr. O and I, we're going to set up a community. That's my email I put in the chat box. Email her, email me. So we can share some of these resources which can help your communities where they are. A lot of the information we need today, it's there. It's there everywhere. But sometimes it's hard to adopt it because time is a factor. So if anyone here wants to reach out to Dr. O and myself, email me or email her or show up next week and say, hey, I want to be part of that club. We are going to form a club where we can connect and talk about our own health and the health of our families. One of the challenges I saw is that it's very hard to impact one person when the family members are not on board, because the decision on what to buy varies from household to household. Sometimes the young kids is who dictate what the family buys, because they throw a fit if you don't give them what they want. Sometimes it's grandma, because grandma would like to eat a certain way. Sometimes it's the father, because the father prefers his fried chicken. Sometimes it's the mother, because food is a comfort, so she would like ice cream every day. So what we found out is that it's a family affair, health and wellness. So looking at it from what are the family needs and how does each member of the family fit into the picture is also key. So knowing how to keep our family members on board is a skill, which we can also help some of our patients as well. So I just thought I would share that. And also to say that journey, we are in it together. We are not going anywhere. So Medical Mondays is here. Invite your friends and come and join this movement of changing lives, one person at a time.
Amen to that. Yes. Dr. Zugu, kindly unmute. Yes.
Yeah, sorry. Yes. To underscore again what Stella is talking about, there's something I forgot to mention, and it's really the concept of using technology to address these conditions. And really the importance of remote monitoring of patients. Like the patient she described who was fainting or dizzy all the time and, thinking that the one medicine from the doctor was, if that patient was in a remote monitoring and embracing that and checking their vitals and submitting to the doctor, they would pick up those things very quickly and address that ahead of time. So one of the things we have to do as a community is really begin to talk to our family members and people to embrace that technology in the doctors or in whatever they are working at, and using that to monitor yourself on a regular basis and monitor themselves and submit the readings. They're not doing a doctor a favor by doing that thing. It's actually for their own health. The same thing with obesity. The same thing with blood pressure, diabetes. Obesity itself, has so many complications. By itself, it can actually cause the heart failure itself. So that by the time you discuss the complications of a medical condition And if they can even just lose £1 a month, if you tell them you lose £1 a month in 5 years' time, like if you're talking about this, time interval thing, 5 years you are down £60, and that will improve your condition much more, as opposed to gaining £60 in 5 years' time, which will worsen your condition. And if you put them on remote monitoring and they're checking that even if it's once a week, they become engaged in really doing to keep that weight down with exercise and proper diet. So please, let's embrace technology and begin to educate our people and even the powers that be. And I'll give you an example. We were trying to open up a site at Abuja, okay? They went and visited that site and they said, no, you have to buy a bungalow to do that. By the time you spend the money to buy a bungalow to reach preventive services to the people, what money are you going to use to help the people in the community?
None.
You see? So sometimes these things are people don't understand that with today's technology, you can impact the community much more deeply, remotely, without having to spend so much money in infrastructure.
Yeah.
We need to educate them.
Yes.
I'll stop there. Yeah.
Thank you so much, Dr. Ezugu. And Madam VP, Madam CEO, before I call on you, I just have to say this about remote monitoring. Dr. Ezugu, I called him about something personal, and he yelled at me. This was a few weeks ago. Dr. Ezugu does not yell. He's very calm. He said, when was the last time you checked your blood pressure? And I kept quiet. I thought about it for a minute, and I said, it must have been about 2 months ago, which is the truth. I normally check my blood pressure. Things has just been going on. A lot was going on, and I haven't checked anything in recent times before he asked me. But, he said so, and it continued. So things calmed down, and a few days ago, this was about less than a week ago, I got down and I checked my blood pressure and I texted my blood pressure and my pulse to him. Instead of this man complimenting me, you know what he said? He said, oh, great prevention. No, great preventive skills, something like that. I'm glad you're working on prevention, but you need to get an high health machine so that you can check your blood pressure and check your blood sugar. And I'm like, wait a minute now. It's taking it to another dimension. I'm like, what's an eye health machine? I didn't even know what that is. I have a blood pressure machine, a sphygmomanometer, That's what we call it. What is he talking about? He said, eye health machine. He said, stop by the office in Baltimore or stop by the house, his house, much closer to mine, and pick one up. I'm like, okay. So I went to his house. And I went to pick one up. Him and his wife gave me one. Right there when I was sitting down there, I connected this thing to my phone. Oh my gosh. It connected to my phone. I took my blood pressure sitting down there. He recorded it and started graphing it. So the eye health machine actually makes you get an app, graphs it, and then you can send it to your doctor. Check your blood sugar. You don't send it. It goes straight to your doctor for remote patient monitoring. So this is eye-opening. I'm looking for some money. Once I get some money, I'm going to get some high health machine. And depending on what, we're going to give it out on Medical Mondays with Dr. O for, people who need it so that, we can do this. But what he just said is key. Monitoring ourselves, if you don't check, you don't know. High blood pressure is a silent killer. A silent killer because there are no symptoms for most people. They go about their lifestyle. Everything is hunky-dory, okay, but their blood pressures are skyrocketingly high and without any warning. People have heart attack, stroke, congestive heart failure, kidney failure, or blindness without any warning. Then if you had diabetes on it, oh my gosh.
Yes.
So monitoring is very important. And thank you, Dr. Ezugu, for my high health. I have it over there in my bed.
I don't know if you guys can hear me, but I'm having problem with this technology thing. But anyway, we thank God. Taking care of yourself and prevention is really key. Thank you so much.
Thank you. Thank you.
Sure.
I didn't want to be a hypocrite. I had to. Thank you. Madam VP, kindly unmute. Kindly unmute. Yes.
Yeah.
Welcome, ma'am. All the way
Thank you.
from California.
Thank you so much, Dr. O. And thank you for that vulnerable sharing, because even as a doctor, you got so busy and, you know, you didn't take care of business, as we all do.
Yeah.
So you've always brought us great speakers, but today is the first time I got a graphic idea of the stomach, you know, and how much we load on it. And I'm thinking about when we go to Nigerian party, everybody loading up the plate. So it's like 10 times that we are putting in more than what we needed to. So Dr. Stella, thank you so much for a fantastic job. And I want to sign up as an ambassador, because I need to check myself, and I need to help other people increase their capacity to be able to do more in terms of this. Because, communication, there are diverse ways to communicate things. This one got me. I got it the way you explained it. Anything more than a fist is an overload.
Yep.
So when we are adding buckets of fufu with vegetable, even when we think that we're trying to eat right, sometimes we have a bowl of vegetable, a bowl that can feed 5 people.
It's stretching the blender.
The blender. Yeah, the blender effect too, it's all over the place. So I would like to sign up, but if I too am having difficulty with my device. I'm not able to do that here, and I'm also at an appointment. So I will connect with Dr. O and get all the details. But thank you for this fantastic presentation. God bless you.
Amen. Thank you so much. You're right. Madam Vivima, you will not believe this. I went to a party this last weekend, not this last one, the one before, my niece's wedding. I had amala and then I had dodo. Can you imagine the combination? I had amala and I had dodo because I could not take my eyes off the dodo. I won't do that at home. It was crazy. I was shocked, but that was what worked for me at that time. And
Yeah.
we all need to change our mindset. It's about mindset changed.
Correct. Thank you for this, for bringing Dr. Stella to us, a lifesaver.
Thank you.
So I promise to change my habit, my bad habit.
Yes, amen. And to be a trainer, because that's what you're signing up for. And she does an excellent job with that.
Yeah, I want to be a trainer. Absolutely. Charity begins at home. So we'll start.
Yes.
Thank you.
Thank you.
Yes, Dr. O, I just wanted to say something. Yes, so we'll do another session about know your body parts. The blender is good. The most scary one is the liver. So the liver is a washing machine. So what I say to my patients is like, could you put Comet scoring powder, right, in your washing machine? And they were like, oh no, I wouldn't do that. I'm like, why would you not put Comet in your washing machine? Oh, it's gonna clog it. So I said, well, the liver is a washing machine, and there are things which can clog the liver, because we know we are suffering from fatty liver globally. It's a problem. People look pregnant with the livers. So we'll do another session where we talk about body parts. But I wanted to leave them with 2 things. There's a way of measuring portions. So we have, and I will share this resource with those who want. If you take your palm of your hand and you trace here, it's a cup. So when people go eat out, the size of a disc, a CD, a disc, it's the size of steak or protein. So there are ways to really quantify things. The thumb, this size of your thumb, that's the amount of butter you should eat, really, literally, and not a pile. So we can talk about these strategies. But what I wanted to leave everybody here with is this. To every person, even us, who are trying our best, we always get to a point where this is the moment I'm going to do something, right? How many of you have done this? I'm going to go home and I'm going to clean up the pantry. So I tell people, don't do that, because food is very expensive. You're going to lose all your food, and then tomorrow you go to the store. Don't do it. Eat what you have. But there's a couple ways of doing it. And this is probably for Madame Lara over there in California. if Madam Lara lives here today and wants to change one thing, do it one thing at a time. I like what Dr. Ezigu said earlier. This is what I do with my clients. I break it down. I tell them there's 52 weeks in a year. If anyone who wants to lose weight loses half a pound a week, how much is that a year? 26 pounds. So I break it down to a quarter of a pound a week goal, because a quarter of a pound a week is a pound a month. And people are like, that's all? I can lose 12 pounds. I want to do more. So in average, most of my clients would lose 2 pounds a week because I break it down to half a pound. So every time they get on that scale, they're looking for half a pound. And if they get a pound, it's a win. So breaking down your goals to where they're biteable is key. And then I'll say this, I'll give you a freebie today. Whenever you identify one thing you want to change, there's 2 scales which are very important. The self-efficacy is one, but I won't say self-efficacy. It sounds complicated. Use the confidence scale. How confident am I that when I wake up in the morning, I'm going to walk? And if you find yourself on a scale of 1 to 10, you are at 5 and under, the chances are you're not going to do it. So you have to ask yourself this: what makes it not a 4 and a 5? Right? Because 4 is 40%. And so most people will be, I don't think I'm going to do it. So you narrow it down to the reason why it's not happening. And it's part of coaching. And I will share with those who want to get the training. It's the same thing with relationships. It's the same thing with our family members. When someone does not feel the need to change, they are not ready. So we have to identify, why are they not ready? Is it because of information? Is it because of motivation? Or is it because of support? So Dr. O and I are going to be your support from now on. So stay connected. Medical Mondays, here we are. Thank you.
Thank you. Thank you so much. You know, when Dr. Izugu said he encourages his patients to lose 1 pound a month, I was thinking, oh my gosh, it's always so much kinder, you know? He's a gentle giant. I encourage my patients to lose 1 pound a week. And now you just said it. You said half pound a week, and then they lose 2 pounds. Because if you lose 1 pound a week, that's 4 pounds, 4 to 5 pounds actually a month. That is huge. And you do it with lifestyle changes, it's amazing. It works perfectly. You don't want to lose 30 pounds in 1 month. That is not sustainable. It means you've done something that you cannot sustain, and you're going to relapse and, you know, regain that weight and get more frustrated. So with lifestyle changes, 1 to 2 pounds a week, excellent. Dr. Booker, kindly unmute.
Yeah, thank you, Dr. Stella, and your enthusiasm is beyond the pale. I just enjoyed your lecture and your comments about your mother and her neck pain. But I just wanted to add something, because I remember when I went to buy Chinese food recently, and they brought me this huge plate. And I remember going to a diabetic conference, and they said, when they bring the food, the next thing you ask for is the takeout container. Take out what you want before you start to eat, because when you eat, you mess over it. So I asked for the takeout container. She looked at me. I said, yeah, before I eat, I take out. And then I just eat what I can. And then the other comment was a friend of mine. We went to a wedding, and she's a physician. Oh, she's hungry. She's complaining how small the pounded yam is. I said, but you have chicken, you have rice, you have this, you have that. Oh, but they should give me more pounded yam, because I took a piece from her. I said, stop it. And do you know she didn't eat half the food? After a while, oh, I don't want any more. So this is how we pick up food and we waste it at Nigerian weddings. We need to be, I think we need to look at what we give people sometimes at some of these weddings, you know. But that's all I had to say. I really enjoy the comments, and I could be a community person to help you all. I would love to.
Fantastic. I'm adding you on because I'm you know, I'm seeing some comments in the chat box. people who want to be part of it. So I'm going to add you. Dr. Akitonde just wrote what you said. Dr. Booker, she said, so why can't we as a community provide less food option at African parties? She said, just a thought. And you know what? I think she's right on the money. I like the varieties though. I think we should provide the options. I think we should maybe, and this is a thought too, maybe get servers that will serve one scoop of rice, that one small scoop of rice, and don't let people serve themselves, but portion the food out to people. So at least we are doing our part to positively impact our community and to help them not to overeat. But like you said, Dr. Booker, people will complain that, oh my gosh, that rice is too small. Or that pounded yam is too small. We have to change. We have to change our mindset. Thank you so much for your comment. Ero Konwa, kindly unmute. I like that. Ero Konwa means the thought of our hearts.
Thank you very much, Dr. O, and thank you very much, Dr. Stella Nemuseso. I hope I pronounced that correctly. This is a fantastic program, one that's I definitely could use a lot of the insights that you've shared today. I have a comment and a question. First, my comment would be no reduction of portions at Nigerian parties, okay? People go there to like really have a good time. So that's not gonna fly. But the question I have for you, Dr. Nemuseso, is what do you have to say about the consumption of palm oil? And I'm specifically bringing this up because I think a lot of the African diet is really organic, right? And certainly some of the starchy things we could consume less of after you get to a certain age. But the rap that palm oil has received, I mean, living in this country for several decades, I think it's unfair. And have good reasons to believe that there's more to it than meets the eye. Could you please share your thoughts on the consumption of palm oil in our diet?
I think you're muted. You are muted.
Thank you. I'm not sure if I can specifically speak to palm oil, but I can probably say this. A lot of people suffer from constipation, okay? So one of the ways I help my clients understand it's time for change, I do a lot of crazy stuff, but this is one of them. I said, we are supposed to move. I say, we are supposed to move our bowels as much as we eat. And they're like, what? So I'll say, do the math. If a person eats 3 meals a day, how many bowels movements are those a week? Then it take a while for people to say 21. I'll like, say it's 21. Then I'll say, so if somebody moves their bowel every other day, how many bowels movements are those a week? And they'll look at me, say, every other day, 3, 4, right? So I'm going to could answer why people resort to things like palm oil, right? And so I would say, well, if 23 minus 4, what is that? It takes a while for people to do 23 minus 4. But what is 23 minus 4? It's 17. So I'll say, well, so if you have moved only 4 times, what do you think happens to the 17 bowel movements? And they'll look at me like, what happens? So I'll use a very bad example, like when a skunk dies on the street, it finally decomposes to become a liquid unless the vultures eat it, right? Or it becomes part of dust. So what the body does with all these feces, which people are full of, it reabsorbs them back as toxins, or people get impaction and people end up with things like polyps, colon cancer, and all this is part of piling up the belly. What goes in should come out. So what has happened over the years, people, because they suffer from constipation, they resort to ways to relieve themselves of the constipation. So whether palm oil works or the Chinese tea work or whatever, the laxative work or not, the truth of the matter is when a person is constipated, they can easily be impacted where they have to be physically remove those feces. Nurses have to use their finger before they can even stick what you call it, a suppository or one of those things to flush it out, because feces can be very dense. And most people suffer from constipation. I said this to one of my friends. She's like, my blood pressure keep going up. I've tried this. I think I'm going to change doctors. I said, why would you change doctors? You see, your belly is a little big. I think you're full of, I didn't call the word. She said, I said, yes, refuse. I used the word refuse. I didn't use the S word. She said, no, why you say this? I said, because you are. Because they've tried everything. But look at you. You're not pregnant. Your stomach is big. She said, you're right. So what should I do? I said, no, because you're not diabetic, I'm going to tell you this. She's my friend, so I could do that for her. I said, perhaps maybe you just need to eat pineapple only and nothing else. My dear friends, my girlfriend was full. Yes. She came back. She said, you were right. Why didn't you tell me this all along? I said, listen, I don't go around and tell people what's wrong with them, but because you came to me and you told. So she started releasing feces. So when people eat 2 meals and they haven't emptied their bowels, they are piling out feces, I'll use the polite word, in their bellies. So a lot of the things we see with mood, with joint disease, with a lot of other problems which we can prevent because people are full. So before going to that Nigerian party and eating a mountain, make sure you move a mountain. That's all I can say. Because if you eat the mountain tonight, anytime after sunset, the pineal gland has shut down because the body is preparing for deep sleep to sleep. You all know that. Sunset, the metabolic system starts shutting down. So anything you eat after sunset can stay in your system for days. And so most people now, they turn to oils, laxatives, mineral oil, and they've used these things in the past. But to be honest, fiber and water is your friend. And unless a person is diabetic, they don't need to wake up in the morning and eat a mountain of food. They need to wake up in the morning and move. And if they're diabetic, then they need a diabetic educator to help them monitor and know where their levels of blood glucose is in the morning before they move. We all know what our ancestors did. I don't need to tell some of you here, I wasn't even born. They used to wake up in the morning and go till the land. So perhaps we are at that point where we are still eating the railroad worker menu when we are sitting in the computer. So I tell my clients this: sitting in front of on the computer all day is not work. No, it's stressful, yes, but it's not work. Work is when you go dig in the trenches, where you go pick up weights. That's work. So what it boils down to, my friends, and before I stop talking, is this. It boils down to the oxygen consumption by the heart muscle, VO2 max. So most people, if they don't move enough to improve their, there's a formula to improve their heart rate with a certain formula. And the formula is 220 minus age, and then you multiply by a percentage. Whoever wants it should contact me because I'm not going to put it out there. There's a formula which then determines how much work your heart is doing. And based on age, the younger you are, the more work you should do on the cardiovascular side. And so at the end of the day, when you eat the mountain and you don't move mountains and you don't push mountains, you're piling up. So the arteries are going to get clogged from extra fat, right? So now you're taking palm oil, which is a fat anyhow. When we know sugar turns into fat or sugar, right? That's what sugar does, turns into fat or sugar. It's either you become diabetic because you're eating a mountain of food, or you have cardiovascular problem because your arteries are clogged. Two things. So my recommendation would be mindful of consuming extra fat, because the excess sugar is turning into fat anyhow, because insulin is a fat storing hormone. It moves sugar into fat or glycogen in the liver. So when we start talking about, yes, so when we start talking about diabetes or anything else, minimizing fat intake should be a goal. So I'm not here to say palm oil is good or bad. Individuals have to decide, do I consume extra oil when already I have extra sugar and extra fat in my food every day? Most people here cook with oil. They put oil in the pot first before they put onion. My mother did it for years and I watched it. In my home, I have 1 jar of coconut oil, which I might use once a week. The body doesn't need fat. Healthy fats come from food like nuts and so forth, and it's sufficient. So cooking it with oil makes it tasty, yes. And then you add palm oil. So I'm not here against any oils. If they work for people, they're getting a relief from them because something is packing somewhere. So why I say this?
I would venture to say you're treading gently. Palm oil has high saturated fats.
Yes.
So fat is important for the body. So is carbohydrate, so is protein. They have to be consumed, in
moderation.
In moderation. Thank you. But palm oil is as saturated fat. You don't want that fat in your system. If you have to eat palm oil, don't make it an everyday thing. If Papa Michael is on the platform, he's going to shout me down and say, no, naturopaths say palm oil is excellent. But I heard him in Bible study on Friday, and he spoke the language of allopaths, that you have to eat it in moderation. So if you have to have palm oil in your vegetable, it's great, but in moderation and not every day. It has saturated fats, and saturated fat is not good fat. So I'm not going to tread gently. I'm just going to say. So Haman from London. Oh, by the way, Mr. Irokonwa, was your question answered? Was your question answered?
Yes, it was. I was hoping to find more support for palm oil, but I'll look elsewhere.
Don't.
Thank you.
Don't look elsewhere, please. And the reason why you don't want to look elsewhere is what you should be looking for is the truth. So sometimes the truth is not what we want or what we're used to, but we should accept it.
Understood.
It's going on in with health these days. That's where we have this platform. Believe me, there are lots of disease entities. Maybe they've always been in existence and we just didn't monitor as well as we do now. I don't know. But I can tell you that things are not how they used to be. And a lot of it has to do with what we put in our mouths, what we put in our bodies. The body does not forgive.
I concur.
Yeah.
Thank you so much, doctors. Appreciate your feedback.
Thank you. And thank you for your question.
So Dr. O, to add on, most diseases we see today boils down to microvascular. And Dr. Izulu can tell you this. To every single cell in our body, blood has to flow. So think about the tiny, tiny little vessels in your eyes, in your kidneys, in your lungs, in your pancreas. When they get clogged with fat, blood doesn't go. So people are dying slowly as these cells die because of clogged arteries. So any excess fat, which is not needed by the body, is going to be stored unless that person is eating a very high fiber content where that fat is being sucked in by fiber and going through the bathroom. But most people don't even eat vegetables or fiber anyhow. And so adding fat is not solving the problem, but it can really harm our health.
That is true. Thank you. Thank you for that addition. Haman in London, he's still up at this time, said, thank you, Dr. Stella, for your presentation. Cooperation with your doctor is absolutely imperative. You take the journey together. And he said he would, he said comments on what food to eat and importantly, how we cook it is most important also. And he would like to get involved with the community learning, get involved with your learning community, and then said, how can he do it though from London? He said, how can I get involved from the UK with the learning community? We have to talk about that and see how we can weave him in. He also said monitoring and submitting results to the doctors is important, that he does this with controlling is blood pressure?
Yes, so we have access, anybody can access from anywhere in the world. So just email or contact Dr. O, and then we can take it from there. I mean, lifelong learning is what we are all about, and we'll make sure everybody has access to what we are talking about here. Just put your email in the chat box or email me or Dr. O, and then we'll connect for sure.
Yeah, and our brother Collins Akwapunam said the blender analogy was scary. Thank you, Doc. It is scary, but it is the truth. I love it. So our brother Minister Adetokunbo Ajayi said, can the 1 plate of pounded yam that we eat at Nigerian party add to our body weight? Dr. Stella, can the 1 plate of pounded yam that we eat at Nigerian parties add to our body weight?
Yes. So take a balloon, right? A balloon, just a regular balloon. Hook it to the faucet at home. Turn the tap water or faucet, whatever you call it, tap is what most people call it, the faucet, turn it on. What happens to the balloon? It starts growing, right? Everybody knows they start growing. Mm-hmm. However, if you take that balloon and you poke some holes in it, and you open the water a little bit at a time, as water goes in and water goes out, you can maintain the size of that balloon, right? It's correct, right? Mm-hmm. So what our bodies do, if something comes in and nothing goes out, the body is going to store it as fat, which is glycogen in the liver, which is why we get fatty cells, fatty liver, or even in the arteries, which affects our cardiovascular system, or you gain weight. So some people will eat that pound and never gain weight. But guess what? They have high cholesterol because that sugar or starch turns into fat. So portion control is key. A cup of starch is all you need in most cases, which is the size of the palm of your hand or a cup. But I'm going to say there's something I learned from one of my senior clients. She was 76. She said, I need to get rid of this diabetes. I said, oh, sure. So we did a session on how to shop and how to cook and how to eat well to prevent diabetes or manage diabetes. She said, I have bought 3 plates, and it made sense to her, and it makes sense to a lot of my seniors. She said, I bought 3 plates. I have my small plate, my small plate, and I have my small plate. So every day, I eat once from each plate. So if I eat the bigger plate for breakfast, I know that I'm going to have to eat the small or the small plate at dinner. But I don't eat from the bigger plate more than once a day. And this lady was able to get off all her medicines for diabetes and high blood pressure because what goes in must come out. Yeah. However, for most people here, what might work is eat more at breakfast because you move more, you burn it, you move it. Having a big dinner is a challenge because if that pound of yam is eaten at dinner time, the shima, the fufu, you store that because you don't move around in your bed. Oh, let me correct myself. Some people do. Most single people don't. So all that sugar stays circulating in your blood, or insulin has to be released and then transfer into the liver as glycogen or fat. So measure this pound, begin to see that maybe just a cup size at a time, the rest vegetables, save some for tomorrow. Most of us here could do well, even intellectually and mood-wise, if we minimize excessive eating of starch. Too much sugar is poison to the brain. It's poison to the body. A normal adult doesn't need as much sugar as we consume in snacks, in sodas. I help people get off sodas. So if anybody has a soda problem, you can pay me and I'll help you get off sodas, because that's one of the most dangerous foods we have in the world is sugary drinks. It's straight up sugar. There's no fiber. So what I tell people is look at the fiber content. So for those who eat a plate of yam, how many times a day are you eating it? Parties don't really matter, but what happens, what goes on the party would carry on for another 6 weeks for most of us. We would just stay in that party mode and then you go to the store. So finally, Dr. O, they say don't go food shopping when you're hungry. When you go food shopping and you're hungry, you buy everything under the sun. And when it comes home with you, you're going to eat it.
Mm-hmm.
So they say, write a list of what you're buying and stick to it. They say, shop around the perimeter of the store because everything else is too processed. And they say, don't buy what's at eye level because usually that's where they place it. So look at the bottom of. So there are some shopping tips. So what I try and do personally, if I don't think something is good for me, I'm not buying it because when it comes home, it looks at me until I do something. So these are some of the things which I think we can take home and say, I will eat what I have, but from now on, I will lean towards the healthy side. It is cheaper to buy a bag of apples than to buy a 2-gallon of apple juice. And apple juice has no fiber, apples have fiber. So sometimes switching things around has helped people. But I want to say this. There are some people who tried everything and it hasn't worked. Please get in touch with me. Let's get you on some proactive wellness with some support from nutraceuticals, which your body can absorb and get you on your path to good health, or your clients and whatever it can apply to. Dr. O, you're amazing. You're an amazing doctor. You and I spent 4 hours on the call this week. Let me let the cat out of the bag, saying, how can we help our people worldwide?
Mm-hmm.
Understand that prevention is key.
Yeah.
So the continuation of this conversation is, so we are so grateful for all those who said, I want to be part of this. Because as we look at the work GAP is doing in Nigeria, as we put more clinics in Ghana, mm-hmm. Let's have some of you volunteer to help with our team GAP so that Dr. Ezugo can continue to say, we are doing this work and we never stop. I won't tell you how many hours Dr. Ezugo works so that people can understand that heart health is key. So lastly, we are going to come to you with a program on high blood pressure, because high blood pressure is a precursor to a lot of problems we see later on in life, mm-hmm. both coming from the organ damage from the use of drugs and also from the aging process which takes time. So stay tuned with us, bring your friends, and let's be the voice which brings the message of proactive wellness to all 4 corners of the world. Together, we can do it. Thank you.
Amen to that. Thank you so much. I have a question in the chat box asking about what the community program is about. I think the person missed it. I would like to, they said they were asking what the community program is about. I have a list of people who are interested. I'm keeping track. I think you're muted. You're muted.
So the community program, we are going to bring you on your portal where we can point you to some of the resources you can use for yourself and others. We are also going to give people an opportunity to consult with Dr. O and I, so we can know who wants to go trained. We are going to make a formal training which allow people to increase their competencies with proactive health. And we are also going to give you access to some of these programs which are out there, which cost money, but changes lives. Because to some people, it's time to do something. And an investment in own health might be a good starting point. So we give people option, but initially there's no cost. Join us, let's talk. If you have a question, we answer. We build a resource for proactive wellness. And we also point you to where you can invest your time and money in learning more. One thing I know, and I tell people—
And you learn to be a trainer also.
Yeah, yes. One thing I tell people is we don't have a shortage of information. If you Google right now diabetes, you probably get 6 million, 7 million results on Google on how many people are talking about it. What we have a challenge with is bridging the gap between what we know and what we do. So the community is going to help every single one of us to know how can we get into action to take this knowledge and make it work, to really apply what we have learned and improve on it and train others and give this gap movement, which we are moving forward with, to the rest of the world. And there is a website also to join, to volunteer for those who are wanting to give their time with GAP. And I'm pitching it on behalf of Dr. Easy because I think he dropped off. But anyhow,
it's
you can. Yes. So that's what the community about, because sometimes people come to Medical Mondays today and next week they are not able to come. They can watch the video, but maybe they want a resource like My Plate. It's there, it's free. Some of the tools we use to assess patients, which you can adopt into your practice and help those who need the help or those who are trying. So things like, and then the trainer program, which we will be launching soon. That's, I think, sums it all, Dr. O.
Yes, thank you so very much. There's a question here that was directed to me about coconut oil in relation to consumption of palm oil. So, do you want to comment on coconut oil in relation to consumption of palm oil?
Well, coconut oil is considered on the healthier side and olive oil, as people say it. But I can tell you this, once you hit any oil over 180 degrees, it really becomes unhealthy, truly speaking, because of the nature of the molecules of fat. So most people prefer coconut oil, but however, it has to be cold pressed, because when it's not cold pressed, it means the extraction from the seed used heat. So it's already not a good source of oil. I personally prefer using coconut oil or grapeseed oil or avocado oil. Personally, it's on the high inside, but I don't use oil every day. So if I'm going to use it once a week, I better use a better oil. So that's what I think.
Thank you. Thank you so much. You know, it seems like, you know, on Medical Mondays, we have talked about this a lot and you hit it on the head. So like Dr. Stella said, coconut oil, grapeseed oil, and avocado oil are heat stable. Those are the ones you cook with. Olive oil is an excellent oil, but once you heat it, then you denature it, it becomes toxic. So you don't want to cook with olive oil. When you're eating your salad or something cold, you can put your olive oil on that, but not cooking. The coconut oil is good for cooking. And it is not in the same class as palm oil. But thank you for that question. Dr. Buka asked, do you believe in pure plant-based diet? Do we get nutritional support from it? Basically, I think is the question.
Thank you. Yes.
Sorry,
so,
should we add extra nutritional support? I'm sorry.
Sorry.
I don't believe in it.
No, ask your question again.
But people say everything is plant-based diet works. I don't believe in it. But I do eat a lot of plant-based food. But if you want to go plant-based, do you need extra nutritional support? Vitamins or anything? That's my question.
Yeah, so the first question is, what do you think? Do you believe in pure plant-based diet was the first question. And if you do we need nutritional support? So Dr. Stella.
Personally, I do believe in plant-based. I was 100% plant-based for years until I started to travel a little more. When you travel, it's very difficult to get what you normally would get at home, because you end up buying salads on the go and you don't have time to wash them the way you want to wash them. So I eat fish. I'm not 100% plant-based, but the only flesh I eat is fish. On average, most people who are on a plant-based diet would need to supplement, unless if they are really like paying attention to what they eat, for sure. Some people who are on plant-based tend to eat too much starch and too much sweets because they are making up for the appetite for other things which they are not eating. Personally, I think part of the reason why I believe in plant-based is because of the way the animals are being treated and the way the animals are being raised. Most chickens are sick before they even get to the plate. You can Google this and see it. And the hormones which some of the animals are being fed are actually irritants for most people. I'll share a story about my mother's experience with chicken at some point, so come back and hear it next time. But my mother was pretty much almost crippled her hands, and she had an allergy to the hormones in the meat. She's 77 now and her hands are fine. But it took a lot of time for her to get to accept that. And when she stopped eating chicken, she started frying fish like crazy until she developed an allergy of fish itself. And I think she's, at a point where she eats what she wants at 77. She's there now, but at 50, she went through this. So my recommendation to anyone who's plant-based, get your labs done by your doctor. Look at your lab results. If those lab results are fine and you feel good and you live well and you're okay, you possibly are a good candidate for plant-based. It's not for everyone. There are some people who would need proteins from animals, but plant-based proteins are there and people have been known to survive on plants alone. As for me, I don't tell people not to stop eating meat, but this is what I tell my clients: add more vegetables. And it has surprised me. A lot of people have gotten off animals because they keep adding vegetables and they find that they don't miss the meat anymore. It's addictive. Meat and sugar is addiction. There's an addiction. It's hard to get off it and be happy. So if you go plant-based and you see yourself, you're miserable and you're sad and you're just grumpy, go eat meat and be happy. They say you're better off eating Twinkie with a friend than broccoli alone. I've known people who are plant-based and they're mean as hell. I mean, what's the point? So I think there has to be a balance between what you believe in and what works as well, and how you feel about your choices. So I will not make anyone get off meat unless if they want to, and they are looking for support, the ways are there and it can be done. Thank you. That's the answer from me, yes.
Thank you. I agree.
So thank you so much. There's one more question. I'm going to answer that question. And before I return back to Dr. Stella to give us her parting remarks and to, just give us those parting words, I want to answer this question really quickly. It's from Haman in London, and it says, is the use of coconut milk better than dairy milk to use with healthy cereal? Absolutely. And I just want to say something, that we human beings are in the animal kingdom. And all animals, when they have babies, they breastfeed the babies, just like humans. We're supposed to breastfeed our babies. When it's time to wean the babies off, the babies are weaned off by animals, and then the animals start grazing or eating what their parents eat, what the other animals eat, except human beings. We are the only species, the only ones in the animal kingdom who continue to drink milk. And then we don't drink milk just in our species alone, we drink across species. We drink cow milk, we drink goat milk, cow cheese, goat cheese, and all of that. I purposely, Dr. Stella, you're laughing. I purposely wanted to handle that question because I think, it helps us understand that, instead of milk across species, then people develop lactose intolerance. They develop all sorts of abdominal issues drinking this milk. And then they have lactose-free milk, lactate, and with all these things in there. Drink almond milk. It's from nuts. Coconut milk, oat milk, so we have options. That being said, I would like to bring up really quickly someone in our community who is adding value to us. Something is very interesting. I say it all the time. You see just 2-3 people do something that is not good, and that country, Nigeria, Zimbabwe, whatever, is now named a bad country because this person did this. But what about our ones who are doing amazing, contributing to our communities? I have a young man here on this platform tonight that I was so glad to see. He had no idea I was going to do this. I texted him when I saw him on the platform. I'm like, hey, I'm bringing you up to, just say something. His name is Mr. Collins Akpakpuna May, and I hope I didn't crucify that name. Akpakpuna Nam. Please unmute, show your face, and tell us about Brain Drain, what you do. And I want to encourage everyone on this platform who have a business to please advertise in this upcoming movie. It's a movie director, so please advertise to support the movie. A lot is going on in Africa, and this man is putting his neck out to create awareness and to actually also give answers. So kindly share. Thank you. Somebody is helping me to share something here. I appreciate it. Is that my baby, Adiola? Where is it? I don't see what you're sharing, but while you're doing that, Mr. Collins, kindly unmute and tell us, in 3 minutes about what you do and the brain drain coming up.
Hello, Dr. O and Dr. Nemuseso. It's an honor for me to be on this platform, and I've gained so much knowledge. I always tell folks that I have an abdominal body metabolism, so I never gain weight. So I eat everything you put in front of me. But that's by the way. But I've learned so much today about wellness. But yes, but I'm a documentary filmmaker from Nigeria, and my first work, I'm passionate about social issues. As someone who is a diaspora returnee to Nigeria myself, I decided to focus on a lot has been written about brain drain, about the negative effects of brain drain. But I've taken the concept beyond that. My first focus was on brain drain, which I screened here in the DMV last year to critical acclaim. And after each screening, we always have a symposium. And the consensus on the last symposium was that the documentary was too one-sided because it focused on Nigerians in the diaspora that are excelling. So when I took the film back to Nigeria to screen, we also had a symposium at the United Nations Auditorium, and it was a very heated conversation. So we decided that I shoot a sequel to highlight Nigerians who have taken the plunge against all odds to relocate back to Nigeria and are excelling. So that's the reason why I shot this brain game, and I'm bringing it here to premiere at the DMV next month, July 21st, at the AFI Theater, downtown Silver Spring. It makes an interesting watch because it encourages everyone that's toying with the idea of moving back home. There's a hidden narrative behind all the negativity that is being flown around about how things are bad at home. My thing is I have nothing against Jakba or Jakbada, which is brain drain or brain gain. I just believe that one must not forget home. Of course, Dr. O, I know of the wonderful things you do back in Nigeria. So for me, I always encourage people to try and make a difference wherever they are from. We don't all have to move back home. The world is a global village, but as long as we don't forget home, it's very important we tie whatever the success that we make out here and tie it to our homes of origin. So that's my message with my films, and I'll be more than happy to have you guys come to the show at the AFI Theater, Silver Spring, on the 21st of July at 5 p.m. And most of the information about what I do is with Dr. O. And I'm sure, so if you need more information, she'll be more than happy to share with you. And thank you so much for it's really an honor and a pleasure for me to be through this session. It's really an eye-opener.
Thank you so very much. I just got a question in the chat box from London that will there be a UK premiere as well? They want you in
Okay, so yes, I'm working on that. I've gotten so many requests to have a UK premiere, but that's it's something I'm looking into for next year. Yes, so there will be, and I'm working on it.
Okay, so my Californian sister said, how does the East Coast get the Eroa Contour? You know, so the West Coast is asking, you know, they're asking for you to come. So North and South California premiere too, they asking.
Yeah, so okay, so I'm inundated. A lot of folks have seen the trailer for this documentary, and I'm inundated with moving this documentary on
You're breaking up. I think you're saying you're working on on moving it to other places, but you are breaking up. We can't hear you anymore. So while he's getting his audio together, you know, I would just interject that we need assistance. It needs assistance. So there's possibility of advertising your business or even just donating or showing up. Come to the show if you are in the DMV area and support it. I will send by email and by text the, you know, the flyer to advertise your business to support this, okay? I will do that before the night is over. And thank you all, but this is so important that we all participate. Oh, they're asking for his contact information. I'll post that here because I have that. I'll post his contact information. And Dr. Stella, are you there?
Yes, Dr. O, yes.
Okay, fantastic. So Haman says, thank you for responding to his question. And it says that the purchase of plant-based foods is declining in the UK due to the increase in the manufacture of these products. Oh, fantastic. So this is the flyer for the, you know, if you look at the bronze, in order to advertise, it's $250 to support this, to advertise your business. So if you scroll up, please keep scrolling up so that people can see the Zelle. I will post it. I'll send it out for our members so that we can support him and help him be successful. So the Zelle remittance is the 347-969-2553. 347-969-2553. Thank you so very much. So back to our, oh, thank you. It's in the chat box too. Thank you, my darling Adiola.
Welcome.
So I'm trying. I hope you're looking, Dr. Stella, to help me with the chat box. Hammond says also from London that big issues in the UK for the National Health Service where, oh, I don't know, take workers from around the world and leave those countries with the vagaries with the issue to deal with their own health services. Oh, I think it's saying that the big issues in the UK, for National Health Service, they're taking workers from around the world to the UK, and then they live in the countries where they're taking these people from without anything. So that is true. That is brain drain. And that is what, this is all about, the premiere that was just shown. That is why it's so important that we all participate to make sure it's a success, and to encourage this young man who has thought to address these issues, bring it into the limelight, and, address issues in our communities that are pertinent to our well-being. Dr. Veronica says, thanks a million for the value added to lives on this platform. Dr. Thank you. Thank you so much, Dr. V. And thanks, Dr. Stella.
Most welcome.
So if you please give us your parting words so that, what we need to take home to remember, that would be fantastic.
Thank you. Yes. So every day is an opportunity to do our best. Sometimes information comes to us at the right time, at the right moment, but the mind is not ready for change. Change can be painful, but change can be fun. One thing which makes me value the ability for a human being to change and cope is a long word, neuroplasticity. Did you know that our brains are like plastic? We can mold them. We can change our thinking. We can change our being. Neuroscience has taught us, and the Bible says this also, by beholding, we become changed. When we look at something and think it's difficult, it becomes difficult very, very much so. The good thing about the way our brains work is this. The neurons, the nerve cells we use more, grow and increase. The ones we don't use, they die. So part of what I see with proactive wellness is people don't want to talk about it. They don't want to think about it. So the ability to change now is hampered by the fact that we are not thinking these things. The Bible says whatever things are pure, whatever things are noble, whatever things are praiseworthy, think ye these things, right?
Amen.
So what I'm going to recommend to every single one of you here, there's still 46 people in here. If you're still here, give yourself a hand. You've done well. Get into the habit of writing down the things you want to work on. Sometimes the list is too long and it's easy to say that's too hard. Find that one thing which is easy to change and work on it. And use the SMART goal. Be specific, measurable, achievable, realistic, and time-bound. Set small goals, and when you've achieved them, give yourself some credit if you don't have cash. Find someone here who can help you to stay on track and hold you accountable, because it takes a village for sure, and it takes someone to hold your hand. There are times when I thought about my weight issue, when I weighed over 330 pounds. I'm even ashamed to say it. I lost about 130 pounds when I embarked on that journey. Because with COVID, I've put some back. Not that much though. I told my friend that, listen, I'm in healthcare. What's going to happen to me when I can't get up the chair? How am I going to help my patients? I got to do something. And she was there to remind me, remember your why. So perhaps it's the time when everybody should get a piece of paper and write their wellness vision. Where do you see yourself next month? Where do you see yourself 6 months? Where do you see yourself a year? And where do you see yourself in 5 years? And who do you envision to be with you? The reason why I embarked on my journey, because I know that most doctors die with diseases because they work hard and forget themselves, because they care for their patients and neglect themselves. Mm-hmm. And I also know that If I don't take care of my health, I'll become a burden to my children. It wouldn't be fair for them to come and take care of mama at 60 when I could have taken care of my own health and stayed independent and relieved them of the burden. And I'm landing here because the burden of care is high. It takes 5 times as much to take care of someone who's diabetic than the one who's not. 5 times. And the rate of dying is 2.5 times higher, dying young. So, that being said, this is going to shock everybody. Are you ready for this? It is projected that by year 2030, there will be less younger people than over 65 in the US. So think about it. The number of caregivers is going to be less. So some of us are going to have to learn to care for others. So in order for us to do that, we got to be well if we are still here. And for the first time, the 65 plus population is going to outnumber the younger population. Because remember, baby boomers changed things around and started living healthier and longer. And America has had 10,000 baby boomers retiring every single day. And I think we are nearing the end of that in the next few years. And those people are still here. So that means the cost of care, that means access, that means the quality of care, because we are still here. So that's one of the reasons why I'm passionate, and Dr. O and Dr. Izugu and I are thinking perhaps each and every one person here needs to become a community health worker so they can help themselves, their families, and those they come in contact with, because at some point, the sick people, number of sick people is going to outnumber the number of beds in our communities. It still is there now. COVID taught us that we run out of beds, and history always repeats itself at some point. So I want to say thank you for being here, and thank you for your kind comments, and thank you for seeking knowledge, information, and skills to take care of you and your family. We look forward to seeing you again, and this is a place to hang out. Stay in touch. Thank you.
Thank you so very much. Dr. Veronica said phenomenal details and retraining the mind. Thanks. Sister Clementina said, thank you so much. This truly is helpful for me, for her. And Brother Las said, thank you, Dr. Stella. We all need to retrain our bodies and minds. This is phenomenal because we're listening. And these are things that, have been surmised. That's what I got out of this too. Hammond said, very true. Many people, younger people, start to suffer health issues once they become carriers, whatever. It says numbers of these people are increasing in the UK. Hammond, you got to write clearly for me to read. And our brethren on iPhone said, thank you so much, Dr. Stella. Great presence tonight. I've learned so much, Haman said. It's all right, Haman. I'm teasing you as usual. Thank you so much for being still awake in London and participating so efficiently. Thank you. Appreciate you. Thank you, everybody. And thank you so much, Dr. Stella. Thank you for being there for everybody, for wanting us to change for the better, for looking after our health. Sister Adiola says, thank you, Dr. Stella. Sister Daisy, Dr. Daisy said, thank you so very much, Dr. Stella. With gratitude, Dr. O, for hosting these life-giving sessions. Another powerful speaker. Brother Ola Okikiolu said, thank you. And Aman is reminding us that it's 2:43 a.m. in London and he's happy to be here. And Pastor Paul says, comprehensively enlightening. Thank you. Dr. Stella, I cannot say thank you enough. I appreciate you. God bless you. Thank you all. Until we meet next week, please be safe. Sister Lola said, the thank yous are still pouring in. I can't help it, sorry. It says, Dr. Alu says, thanks a lot, Dr. Stella and Dr. O, for another refreshing, informative session. And Sister Lola says, thank you, Dr. Stella. I needed to hear this, she said. She said she came in late, therefore she's going to go back and listen to the whole thing again on YouTube or Facebook, and most importantly, to share with her children. Thank you. Sister Chade says thank you. And Sister Ola says, Ola is a she. Oh, I'm so sorry. Yes. So that's Sister Ola Okikiolu. Thank you so much for correcting me. I don't know how I made that mistake. And Dr. Ajay wrote that from Dr. Tay. It says, we'll take care of our bodies. We will live to the glory of God. Amen. Randall Lacasse says, thank you. And Haman says, God bless everyone. Hot in London at present, humid tonight. Happy midnight. So thank you, Haman. And thank you, everyone. We appreciate you.